Okay, hi everyone. We are group four. We're going to be presenting on the gestational diabetes mellitus experience of the Aboriginal women. And here are the group members. So this is just a rundown of how the presentation is going to go. We have all of these labeled and listed with a little bit of a description underneath, and we're going to be starting out with the introduction. So quickly, I just wanted to mention that the Mi'kmaq women were sacred in that they have been given the special role by the creator that this was to give life. So they were in charge of like raising children, gathering food, making like clothing, and just like creative aspects. And I wanted to also introduce what exactly GDM, which is gestational diabetes mellitus, was. And according to the National Health Institute, it's a form of hyperglycemia that develops during pregnancy that poses as a risk to both the mother and the fetus. Next. Thank you. And so based on the paper, I've seen that the author's research included the Mi'kmaq women speaking about having GDM. It was like a participatory research experiment where they had like a group of Mi'kmaq women just talking about what they go through. And they used the two-eyed seeing approach by combining the indigenous and Western perspectives to examine factors like barriers to healthcare, what they were unable to attain based on like the system set up for them, social contributors to health, and also the importance of culturally aware or culturally safe care. So basically care that goes towards what they need, their needs specifically, and catered and tailored to them. And the results of the paper highlight their resilience and efforts made to improve health outcomes amidst their current challenges. So what they have gone through to basically raise awareness and also shed light on what they need, what it is that caters to them, and so forth that are mentioned in the paper.
Okay, so starting off, we will be talking about two-eyed seeing and how it is incorporated in this topic. Next slide. So in the article, it discusses the integration of Indigenous knowledge and scientific knowledge through the framework of participatory action research and the two-eyed seeing approach. This approach essentially emphasizes the importance of combining both Indigenous and Western scientific perspectives to create a more holistic understanding of health issues, particularly in the context of Aboriginal communities. The benefits that this approach brings is that it allows for a more comprehensive understanding of health issues by recognizing the strengths and limitations of both knowledge systems. This concept aims to empower Indigenous communities by involving them in the research process and ensuring that their voices and experiences are central to their findings. So the article highlights the way Indigenous knowledge has been incorporated into this issue by emphasizing the value of traditional knowledge, culture practices, and community engagement. Indigenous knowledge is respected and integrated into the research process, allowing for a deeper understanding of the experiences and the need of Mi'kmaq women. This includes the use of storytelling and talking circles, which are preferred methods of communication within Indigenous cultures, which fosters a relational approach to knowledge sharing. Furthermore, the study also highlights and showcases the scientific methods and the use of Western lenses to analyze health data and understand the prevalence of gestational diabetes among Mi'kmaq women. This includes gathering quantitative data and applying the health research methodologies to assess the impact of gestational diabetes in the community. Overall, the study essentially advocates for a collaborative approach that respects and essentially integrates Indigenous knowledge with scientific knowledge and an inquiry to improve health outcomes for Mi'kmaq women and their communities.
Where's the note?
So there are two major triumphs discussed in this paper. These triumphs focus on addressing the social determinants of health and fostering empowerment through action. Next, please. So regarding addressing social determinants, the two-eyed seeing approach was pivotal in tackling the root causes of health disparities faced by the Mi'kmaq communities, particularly those linked to social determinants of health. Researchers and participants advocated for systematic changes to address issues such as poverty, lack of transportation, and limited access to nutritious foods. Specific advocacy efforts included suggesting the creation of local food banks to combat food insecurity, increasing funding for transportation services to improve access to healthcare and grocery stores, and also encouraging culturally safe, community centered healthcare practices to ensure respect and understanding for the indigenous traditions. These efforts not only raised awareness about these pressing issues, but also inspired initiatives like the community gardens, which served as a practical solution for improving access to fresh produce. Empowerment was a critical outcome achieved through two main types of action. One was a participant-led initiative. The women took the lead in creating community gardens, which improved access to fresh, nutritious food and improved healthier eating habits. They also shared knowledge within their communities to encourage the adaptation of healthier practices, fostering a long-lasting positive change. Secondly, there was a collective advocacy. Participants advocated for hiring full-time dietitians in their health centers to provide consistent support for nutrition and diabetes care. They also emphasized the need for culturally safe care in broader healthcare system, encouraging that indigenous voices and traditions are respected in medical settings. Finally, the combined efforts, both personal and collective, demonstrated how 2IC's approach empowered individuals and communities to take meaningful action. The resulting changes have created a long-lasting impact, not only improving the immediate health outcomes, but also layering the groundwork for sustainable community health improvements.
All right, so some challenges that they spoke about that affected these women before they actually were able to have those triumphs. So some general research was that for the paper itself, there were only 9 participants, which in itself is not a whole lot. But when you look at the actual numbers of this specific demographic, it was very low. So there were 9 participants between 2 communities. Approximately 3 to 20% of pregnancies do develop GDM. And within those communities, there are approximately 70,000 people who claim to be Mi'kmaq across the United States and Canada. And when you look more broadly, across the United States and Canada, there are approximately 375 million people. So 70,000 is quite a small demographic. So overall, just having 9 participants is quite small. But with the number of how many Mi'kmaq people there are, it's pretty good. And then just overall, some challenges that these women have spoke about that were overall, some have been changed, is that firstly, the financial problem that they were facing. So out of the 9 participants, there were only 4 of them that were employed, which due to that, having access to a healthy diet was quite difficult for them. And overall, just having easy access to grocery stores, or even just having financial resources was a huge issue that they spoke about. In addition, the having cultural safety, so having doctors who actually understand these Aboriginal women and understand the culture and community that they are in and their cultural significances with their health is something that was very important to them. Yeah.
Can't hear you.
Somebody's on mute.
Whoever's supposed to be talking is muted, I think. Could somebody from the Real, could somebody from the Real Housewives take over for Jacob and just walk us through the slide?
Okay, I can take over for that. Right. So what's left to do? So how can we improve like the experience of the Micmac women? So based on the slides that Jacob has added, he has said that more funding can go towards these women by improving the access to the healthcare. As previously mentioned in the introduction, having culturally safe services and reducing the health disparities. So all of these kind of go towards like what they can experience, like medically, like physically, all of the experiences that they've shared, all the challenges that they've gone through personally, and just as a whole, these can improve their experience just in general. In addition to that, the addition of proactive nurses, in the sense that they would have like the advocacy for the culturally safe care, educating themselves and others in how they can help the Micmac women, empowering Indigenous voices to speak out and speak up on their personal experiences and those of others, because just speaking up from an Indigenous perspective can help the others who don't have that advocacy for themselves, and challenging the status quo, just so we don't have what's it called, like the same thing happening over again. We have a change in what's happening, and so this can go for generations to come. In terms of culturally safe healthcare practices, we can integrate Indigenous knowledge into the Western practices so that we can use a two-eyed seeing approach to kind of improve the healthcare practices and medical interventions due to the Indigenous perspectives being spoken out can improve this. And the community-based support programs, we have the programs rooted in the community that once you have the access to healthcare professionals in the community, we can also improve the experience of these women. We also have the educational initiatives and improved access to care. So storytelling, or visual aids is something that's very big in these communities. And so by using this, we can get that spread across the community, and clear communication of the impacts of GDM can also affect the people who are now learning about these experiences. And expanding to remote communities cannot just introduce what's happening to these communities, but also have an act being done to improve what they've been going through and the continuity of care as well. There's also policy changes and research and data collection that can be done in terms of like the continuation of assessing women with GDM to analyze data and hopefully come up with solutions for these problems, as well as national frameworks that can play a part as well. And lastly, we have the summary of what we've read through this paper. And that just includes the fact that Aboriginal women with GDM have faced many challenges, but also have achieved many great triumphs just because they have spoken up for themselves, they have fought for their rights, they have fought for just the inclusion and culturally safe care for themselves. And the inclusion of scientific knowledge allows for the analysis of their input in order to improve their health outcome as well as that of other communities. The Mi'kmaq women were successfully able to leverage community resources, argued for better treatment towards them, took charge of their health, and showed benefits of the two-eyed seeing approach in attempts to better the treatment and experiences that these women have gone through. There wasn't much research for this group as there was a very small demographic and they are in need of more support. So just more research being done can very greatly impact them. And implementations such as proactive nurses, educational initiatives, and improved access to care are all beneficial for the needs of these women. There were other things mentioned as well in the challenges section, or like what's left to do. So like the proactive nurses, just educating communities and analyzing more data, spreading out to communities that are unaware of these experiences, just things like these, just kind of spreading the knowledge, spreading what these women are going through, just these women in general with GDM, spreading that to the just in general, spreading it, getting the word out can really help improve the health outcome of these women. And I believe that draws our presentation to a conclusion. Thank you.
Okay, thanks very much, Real Housewives. Paul, your thoughts?
Yeah, well done. I never heard of that before, but I was also wondering, was there any implications to the child, like being born with any medical issues because of this particular thing that they're dealing with? And I also wanted to point out that, or maybe just a little bit of cultural kind of a thing, that Aboriginal, one of their roles in our tradition is that women kind of speak on behalf of the water because they have that ability to create life in water. So that's one of their roles. I just put that out there as a kind of a cultural point. Well done.
Yeah, I think occasionally, at least I've heard the group might have read otherwise. That the baby is bigger in cases where there is gestational diabetes. It can cause kind of overgrowth of the fetus, if that makes any sense.
Yeah, I get you.